Funding for Yale Cancer Answers is provided by Smilo Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anish Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about living a value-based life with cancer with Dr. Gabriel Cartagena. Dr. Cartagena is an assistant professor of psychiatry at the Yale School of Medicine, where Dr. Chagpar is a professor of surgical oncology.
So, Gabriel, maybe we can start off by you telling us a little bit more about yourself and what it is you do.
Oh gosh, where do I start? Well, I'm a licensed clinical psychologist with an emphasis in training in health psychology and a further expertise in psycho-oncology, which is the psychosocial support of cancer-related distress. I grew up in a military family from Puerto Rico. And after moving around a lot, one of the things I was observing between the diaspora and my homeland in Puerto Rico was the significant disparities with regard to cancer mortality, cancer occurrence, the juxtaposition between that for individuals who lived on the island as opposed to those diaspora who lived on the mainland. And that completely impacted my family and continues to impact my family and was very formative for the way that I was viewing health at a very young age. From there, I developed a really, passionate interest in public health at the nexus of psychology and medicine. So in my undergraduate training, I studied survivorship and chronic illness, particularly HIV and cancer, in Alaska as well as in South Africa. And then I completed my graduate training at the University of Florida, specifically in psycho-oncology. And the rest is history. I never looked back. I fell in love with this field.
You certainly have been around a lot and have had a lot of life experiences. Talk to us a little bit more about those formative experiences that kind of shaped your career. You had talked a little bit about the disparities that you saw growing up in Puerto Rico. Tell us a bit more about what exactly those disparities were and how it is that really shaped what you do now, and how do you try to address those disparities?
These are great questions. Some of the most formative experiences that influenced not only my career in psycho-oncology, but also my career in cancer health disparities research and advocacy work has been in noticing the fundamental lack of infrastructure when it comes to healthcare access in Puerto Rico itself. So the ability for family members to just get regular screenings, the accessibility that's there, the access to and supply, for lack of a better word, of healthcare professionals working on the island. Each of those was detrimental to the outcomes of particular family members, but also to the Puerto Rican community at large. And so those experiences, as I saw the lack of access really impacting long-term the occurrence of cancer, the outcomes of cancer, and unfortunately the mortality that struck my family, started to make me think about why these inequities exist structurally. What is the relationship between historically Puerto Rico and the United States that facilitated these disparities? And then as someone who's growing up then in the diaspora who has the privilege of more accessibility to healthcare, different access to education and different opportunities in that realm, what could I do with my privilege to address these disparities in a comprehensive way? And so going through my undergraduate training and then my graduate training, I started to realize that as a psychologist, there is not only a level of education, but also a level of power, particularly within a healthcare system, to not only support the psychosocial needs of someone who's undergoing cancer treatment or even in survivorship, but to also be the loudest voice in the room when it comes to advocating for the needs of this individual in a medical setting or a healthcare team. And that proved to be really invaluable to me, not only in a clinical context, where individuals who are going through treatment don't necessarily know what should be next or what could be next and are relying on the voice of their provider in order to guide their next steps. But that should always align with what their values are, and sometimes that gets lost in the mix. So from the clinical standpoint, all of my previous experiences have informed the way that I advocate for the patient on top of providing therapeutic intervention, as well as my research work when it comes to provider level and community level interventions to improve cancer outcomes for minoritized groups.
You know, one of the statements that you made just now was really aligning what you are advocating for, thinking about living a value-based life with cancer. Can you talk a little bit more about what exactly that means?
Absolutely. This conversation that I have with my patients, I get the feedback that it often feels like sort of a trite phrase, living based on your values. It's definitely one that we use a lot within the psychological realm, but it holds a lot of weight and a lot of importance, particularly in the context of a cancer diagnosis and treatment, where a lot of my patients call it a right hook to the jaw in their life. They didn't see it coming. They had no guidebook as to what to do next and no understanding of what to do next other than the skills that they've acquired throughout their entire life in order to get to where they are now. And there's a sense of helplessness and hopelessness. And in the pursuit of figuring out what the next step is to grapple with this uncertainty, what gets lost in the mix more often than not is what's valuable to you. You're undergoing treatment. You are shifting your entire life, your family's life, the life of your chosen family or your loved ones, to survive, essentially. And in that process, there's very little time for individuals to sit and reflect on what's important to them in the moment, other than survival. And one of the key aspects that I do in my work is to work with the individual on a one-on-one basis, as well as with their team, to truly tap into and understand what is the richness of their life, what is valuable to them, and what's important to them throughout this process. Because without those as anchors, it's incredibly, incredibly distressing to go through this process.
I can imagine how those conversations play in, particularly for patients who may be, at the end of life, thinking about decisions like, do I pursue more aggressive treatment that may make me sicker, may make me be in the hospital longer, versus being with my family and being comfortable? Can you talk a little bit more about those kinds of discussions that you have with patients? Because I can imagine that that's very difficult, because one would imagine that the base instinct is, I want to survive at any cost. I'll do whatever it takes. But sometimes that may not be exactly aligned with your true values.
Absolutely. In having these conversations, they often come up, as you mentioned, at this really critical and difficult nexus where the individual is trying to balance, well, I want to live the most life that I possibly can, and balance it with, well, what is the quality of the life that I'm going to be living as well? And it's a hard conversation that's often preempted by the medical team and then brought to bear within the therapeutic context, where we talk about, well, what would quality of life actually look like if you took option A with regard to treatment, if you pursued more aggressive treatment, understanding some of the risks, processing some of the risks that your medical provider had just discussed with you. What would your life look like? Is that something that you would be okay with? Would you feel comfortable living months, if not a year more, if it meant that your quality of life was lesser, if you're perhaps less mobile, less able to connect with your family members or your loved ones or your chosen family? In what way would you feel comfortable with that process? And what decisions are going to align you the most with how you would like your quality of life to be and how you would like your life to continue to be?
Yeah, for sure. And I can imagine that not all of these conversations necessarily have to be at the end of life. I can imagine that some of these conversations may be even while you're undergoing treatment and thinking about, what is valuable to you and where do you want to expend your energy. So I know that many patients, before they get a cancer diagnosis, which, as you mentioned, is very often like, the unseen right hook, are doing everything. They are looking after the kids in the home and going to work and doing 17,000 things. And now all of a sudden, you're faced with this diagnosis, you're undergoing treatment, and you have to prioritize where you are going to expend your energy. Are those the kinds of conversations that you have with patients as well? And what kinds of advice do you give them when they have what one of my patients called the superwoman complex?
I'm very familiar with the superwoman complex. It comes up a lot with the people that I work with. And it's a difficult conversation to have because for many individuals, while they recognize that it's important to take care of themselves, that's why they're coming to their oncologist to begin with, They have a profound love for their family, for the roles that they have, for the many hats that they wear. And there's external feedback that individuals are given that any difficult emotions that they are experiencing at the time is too much for anyone else to handle, and it needs to be put away in a box. And then we have internal feedback that tells us, well, I have to put on a strong face for the people that I love. I can't let anyone know that I'm struggling because there are implications or implications for my character or my sense of self if people were to know that I was struggling with this diagnosis. And so the conversation, more often than not, begins with talking about the different roles that are important to you. What hats do you wear? What things make you who you are, and what things you have a profound relationship with? And then we start to challenge and talk about, well, if you're struggling with this and you were to let your family see, for instance, or the people that you care about see this, for instance, how would that change their perception of you? Would it actually change their perception of you? Or would they perhaps view you as even stronger for seeking out support, for modeling what healthy coping looks like?
Yeah, for sure. I can imagine that for many patients, that's difficult to ask for help. But as you say, it often is not only modeling what good coping behavior looks like, but giving your family the opportunity to be part of this journey with you. Because very often people want to help and they want to be close to you, and they want to show you that they love you and they care for you. And by voicing how they can do that, you often can allow them to be part of that journey with you.
Absolutely. And I want to recognize some of the prior question that you had mentioned, which is what advice would I give with regard to having these conversations, starting these conversations, and then developing the coping strategies that are necessary to get through this. For someone who's newly diagnosed or starting in treatment, there are a few things that I would really recommend. The first one almost feels a little bit trite too, but it's breathe. It'll be the first thing that any therapist tells you, and the only thing that will allow you to ground yourself to your body and to the present moment. And the next one is to be compassionate with yourself. No one has developed a guidebook and given it to you regarding how to navigate any of this. This is all uncharted territory, and you're using the skills that you've developed throughout your entire life in order to survive this moment, and you're doing the absolute best that you can. And the next one, really aligned with our topic of conversation, is to be true to yourself. Thinking about and reflecting on what's important to you, whether that's your family, your different roles, the values that you have, those are the anchors that are important to develop, think about, harness, and touch base on. And then from there, giving yourself permission to feel what it is you're feeling. Our society, more often than not, has a really complicated relationship with complicated feelings, such as grief, anger, frustration, and fear. Allowing yourself to feel those allows you to essentially name what the struggle is, and it gives you more power and it gives you more ability to develop the coping strategies that are necessary to battle the uncertainty, battle the depression, battle the anxiety that are often inherent to a cancer diagnosis. And then finally, kind of dovetailing, reminding yourself that it's okay to get support from others. Support systems are crucial, particularly here.
Yeah, all good tips. We do need to take a short break for a medical minute, but please stay tuned to learn more about living a value-based life with cancer with my guest, Dr. Gabriel Cartagena.
Funding for Yale Cancer Answers comes from Smilo Cancer Hospital, where the lung cancer screening program provides screening to those at risk for lung cancer and individualized state-of-the-art evaluation of lung nodules. To learn more, visit smilocancerhospital.org. The American Cancer Society estimates that more than 65,000 Americans will be diagnosed with head and neck cancer this year, making up about 4% of all cancers diagnosed. When detected early, however, head and neck cancers are easily treated and highly curable. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilo Cancer Hospital, to test innovative new treatments for head and neck cancers. Yale Cancer Center was recently awarded grants from the National Institutes of Health to fund the Yale Head and Neck Cancer Specialized Program of Research Excellence, or SPORE, to address critical barriers to treatment of head and neck squamous cell carcinoma due to resistance to immune, DNA damaging, and targeted therapy. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I'm joined tonight by my guest, Dr. Gabriel Cartagena. We're discussing the field of psycho-oncology and living a value-based life with cancer. Now, before the break, we were talking about the many kind of psychological afflictions on top of the physical afflictions that a cancer diagnosis brings. Everything from fear to existential crisis. So, Gabriel, maybe you can talk a little bit more specifically about some of the tricks and tools that you give your patients in terms of managing through these crises.
It's a great question. So there are different evidence-based modalities that I use in my work in psycho-oncology. And there's no one-size-fits-all treatment for the people that I work with. In fact, it's a combination of different skills and different tactics that are the most important to helping anyone develop their toolbox to manage their cancer diagnosis and get through treatment. And so one of the primary ones is cognitive behavioral therapy, also known as CBT. And that's a psychotherapy that really focuses on how we feel, how we think, and how we behave intertwines, and where in that triangle exists the most distress for you. And so, for instance, I like to pull an example that's cancer-related for an individual who has really no history of being truly angry or frustrated or having outbursts. They're noticing that since their diagnosis, they're more angry and frustrated at what they regard as the smallest things. They can't really anticipate it. They don't know where it's coming from, but suddenly they're having an outburst in the kitchen at family members that they would have never done that with. And so one of the places that we start when it comes to cognitive behavioral therapy, for instance, is really honing in on, well, what was your experience before? What are the events that led up to or the antecedents to that moment? Can you remember what you were thinking and feeling during that moment? How did your body feel? And then afterward, how did you feel and think? And more often than not, the people that I work with at the very outset, when we start to ask these fundamental questions, have a hard time remembering any of the nuance of the moment or the distress that they were going through. And so the key part of CBT at the very beginning is to build awareness. How am I thinking, feeling, responding, behaving throughout these instances, both in distress and outside of distress? And that greater awareness allows us to dig deeper into, well, why did that occur? And so in this particular instance that I'm bringing up for the cancer patient, they find that they're being triggered when there's even a semblance of a mention of the future. So a family member talks about a concert that they want to go to in 5 to 6 months. Well, that 5 to 6 months to this patient is uncertain. But to be reminded of that uncertainty brings a significant level of distress. And at this point, they don't really have the language to be able to express to the person that they love that this is distressing. But they do know within their body that it exists. And so the next level of work that we do in CBT, now that we've kind of identified the how and the why, is, well, what do I do with this knowledge? What do I do with this awareness? And what skills do I pull in? And in a moment where you're feeling particularly angry and irritable and it feels as though, let's say, for instance, uncontrollable, skills like diaphragmatic breathing, progressive muscle relaxation are things that you can do individually, even outside of the sight of family members, that you can do them privately, that allow you to touch base with your body and how you're feeling and bring you back to awareness of the current moment, awareness of your emotions, and an understanding of what was the antecedent, what did you experience. And now that you have the skills to kind of temper the previous frustration, then we develop the language to respond differently, to start to develop the communication styles that would be necessary to talk through the distress with a partner or with a loved one. And then eventually be able to look at the mention of the future, the mention of uncertainty, with a few more skills in your toolbox than you had before, and a supportive partner who's on the same page with you and understanding of what you're experiencing in the moment. Another one of them is acceptance and commitment therapy, also known as ACT. And that one is sort of similar to CBT, but it's more focused on being present, mindful, and non-judgmental of the thoughts and feelings that you're having. It often characterizes the anxiety that you experience as fleeting and something that you should welcome. And I know that can sound kind of strange, but I often talk to my patients about welcoming uncertainty into the room. You pull up a chair for it. You sit it down, you get acquainted with it, you get a better understanding of it. And through welcoming uncertainty and allowing it to exist in the space, you can both live your life in a fruitful and meaningful way, in a value-based way, as well as allow the thought and the feeling, however scary or however dangerous it may feel, to come in, sit with you, and come out.
Yeah, a lot of that sounds very similar to techniques of mindfulness that we've talked about previously on this show. Are the two related?
They are often related. And that's a great question because there are many different mindfulness principles, particularly in the evolution of psycho-oncology, that are being folded into evidence-based practices and treatment. And so mindfulness in and of itself, as an Eastern practice, focuses on the present moment and allows different aspects of the present moment to continue to pass in an acceptable way. So without any judgment, the reality of the situation as it occurs now, the reality of your thought as it occurs now, is a thought that is occurring now, but it has no predication on the future, and therefore can be experienced now, can be welcomed now, and then can pass through so that you can move on to the next aspect of your life. And so those core tenets of being able to accept the current moment and be present with the current moment as much as possible in a non-judgmental way are folded into some of the acceptance and commitment therapy principles that we do in treatment, as well as something like cognitive behavioral therapy too. The cognition piece of CBT, for instance, we start to break down and chew on the really distressing thoughts that might occur to someone who's going through cancer. And a lot of that approach necessitates a non-judgmental stance and a mindful stance.
Yeah, I can imagine that, some people who may be listening to this might really resonate with them, and the concept of being present and non-judgmental and, having a thought, accepting the thought, and then letting it go. Very much similar to meditation practices and so on. Others, I can imagine, however, may be thinking, this is all a little too zen for me. If I've been just diagnosed with cancer, my thoughts are going to be racing in terms of, number one, I don't really like the diagnosis. Number two, I'm grappling with my own mortality. And number three, I'm worried about all of the practicalities. What's going to happen to my kids? What's going to happen to the finances? What's going to happen? Am I going to be able to keep my next meal down? And so it may be really difficult for some people to kind of accept this idea of being present and non-judgmental. How do you deal with that?
That's a wonderful question, because most of the people that I work with out of the gate, that is their response to not only some of the principles that I start to introduce. So if I'm starting to give a little bit of psychoeducation as to what ACT or CBT is, but also feedback that they have from what they've heard about psychotherapy so far. And the first thing I always want to do is completely validate the reactions and the responses that they have to this primordial uncertainty. Like I said before, it is a right hook that you did not see coming. And so your responses and your questions with regard to, well, what happens tomorrow? What will happen to my family members? What will that relationship look like? What are the practicalities, both financial? We could talk about financial toxicity and the way that that plays in there too, but also more practical with regard to schedule, with regard to work, with regard to what my body will look like afterward. Each of these questions is so incredibly valid and important to even begin psychotherapy and begin a treatment that's going to be helpful. Does not necessitate the idea of, well, that's a thought and it can pass through and then you will be okay. It's about sitting with the uncertainty, of validating it completely, knowing that it will exist and that it is inherent to the process, and being able to contend with it in a way that allows you to make something of it and allow you to live your life. So what does that look like? So you come in with incredible anxiety and distress regarding this diagnosis. You're asking the questions about the future and the uncertainty that that holds. However, when You sit in the therapy room, or you try to navigate things with a spouse or a partner, for instance. Complete shutting down with regard to the conversation. And avoidance is what we would call it in the therapeutic terms. But that avoidance fosters much more distress, more levels of depression, more anxiety. And so there needs to be a balance, particularly when it comes to psychotherapy. And that's what the core tenet of being mindful is. The balance between the distress that you experience and allowing yourself to experience it, and sitting with it in such a way and developing the skills to manage your emotions when it comes to how you're feeling about it, such that you can observe it differently. When you're in the heat of distress without those skills, it's really hard to think of, well, what do I do next? Even when it comes to something like scheduling the next appointment. If you have the skills developed in therapy to be able to look at the situation differently, still feel the same amount of anxiety because nothing about that anxiety has changed, but to merely look at the thought differently, to look at the experience differently, you might be able to contend with it differently as well. You might be able to say, well, I'm going to schedule it in this way that aligns with my values now. I can talk a little bit more to my partner, the people that I value, about this now and start to build my support network. I can start to engage with things that are really important to me despite feeling fatigue, despite feeling pain, and I get to choose what that looks like rather than the anxiety or depression feeling so overwhelming that you wouldn't be able to do that, either of those things.
Yeah, it makes me think that, this idea of being present, it really may not solve all of the problems of the world, but it may not put out the fire, but it might clear some of the smoke so that at least there's clear air for you now to think about how you will put out the fire, how you will deal with the issues without having the fog of all of the emotions that you might be feeling running rampant that sometimes can get in the way. And I think that might really be a way to help people who may come at this with, but I just need solutions to my problems. It sounds more like that what you're doing with psycho-oncology might not be solving the problem of, this is how you're going to make your schedule and this is how the finances will play out, but more so, let me help you to clear your mind such that you are able to now more productively focus on those solutions. Is that right?
Absolutely. The ability to gain clarity and also master what it is that you're feeling in a way that's productive, in a way that's value-based. So when you are in situations in which you're feeling incredible distress, those even getting closer to a solution-oriented or problem-focused sort of path when it comes to what's my schedule going to look like, or finances, or even how I'm going to navigate the fact that I have these things at home that I want to do, but I'm experiencing pain or fatigue from treatment. It's more difficult to do those things when you're in the depths of distress, if you're avoiding the distress or if you have no support system there. So psychotherapy, as you had mentioned, really does a lot of the validation work as well as the skill work in order to be able to clear some sort of path for you to get to the next step that you want to get to. And so the brush, we would say, is the emotional distress that is inherent to and completely valid for the experience. And the skills are your machete, pretty much, to clear through the brush and give yourself the vision of what that new path could look like.
Dr. Gabriel Cartagena is an assistant professor of psychiatry at the Yale School of Medicine. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next week to learn more about the fight against cancer here on Connecticut Public Radio. Funding for Yale Cancer Answers is provided by Smilo Cancer Hospital.